Hi everyone, my name is Domonkos, and my practicum placement was with the Provincial Health Service Authority's Population and Public Health Program. My practicum project, I've called it Healthy Housing Reviewing the Evidence, was part of a larger project called the Healthy Built Environment Linkages Toolkit. So in order to give you a better sense of what my project's about, I'm going to start by giving you some background about the larger project on the Healthy Built Environment Linkages Toolkit. So the built environment refers to the human-made or modified surroundings in which we live, work, and play. These include our homes, our schools, communities, workplaces, transportation systems, and many other things. And these can vary from small-scale rural developments to large-scale urban developments. The Healthy Built Environment Linkages Toolkit is a first-of-its-kind evidence-based and expert-informed resource that links physical features of the built environment to health-related outcomes. The main purpose of the toolkit is to increase intersectoral collaboration in order to promote the planning and creation of healthier built environments, as well as to inform healthy built environment decision making. As you can see from the model here, there are 5 physical features that are included in the Healthy Built Environment model, and there was a literature review and a strength of evidence assessment that was conducted for each of the 5 physical features. And for my culminating project, I did the literature review and strength of evidence analysis for healthy housing. So the purpose of the literature review was to identify research evidence linking physical features of housing to impacts and health-related outcomes. There are 3 research variables that were analyzed in the literature review, and I've included a diagram here to kind of simplify the possible relationships between the 3 research variables. So to begin, the first one, the planning principle related variable is the independent research variable that is being manipulated and is closely related to a planning principle, which was drafted based on an initial evidence review from a scoping review. The second one, the impact, is an intermediary variable that may result from manipulation of the planning principle related variable, but it must note that not all studies include analysis of the impact variable. That doesn't mean it doesn't exist, simply that not all studies analyze this. And lastly, the health related outcome is a dependent variable that is health related. So the purpose of this slide is to kind of give you a visual representation of the 3 research variables and also to show how planning principles were used in this project. So as I mentioned, a scoping review was conducted by a consultant in order to get a sense of the breadth and depth of the available research linking housing interventions to impacts and health-related outcomes. The review helps to create draft planning principles, which are broad statements that summarize related independent variables from the research. So the example I have posted here, in the research, there were research interventions related to exposure to noise pollution, air pollution, pesticides, and radon. And these can all be classified as environmental hazards. And exposure to these hazards is related to the siting and zoning of housing. So the planning principle that was created to summarize these related independent variables was site and zone housing developments to minimize exposure to environmental hazards. So due to time constraints, it was decided that reviews would be the key source of research information, or research evidence rather, because they generally contain a large number of primary studies. So the inclusion criteria for my literature review is peer-reviewed scholarly journal articles, ideally from reviews as a study type, published since the year 2000, available in English, and including assessed interventions related to housing with measurements of health or health-related outcomes as health-related variables as intervention outcomes. And the diagram I've here is to describe the sources of my research evidence, and in total I was able to find 54 studies that met my inclusion criteria for the literature review. So the evidence that was reviewed from the studies was organized into a spreadsheet, and the quality of the studies was analyzed according to criteria such as whether or not the findings from the studies were statistically significant, if there were significant gaps in the literature, and also I used study-specific tools to grade the quality of individual studies such as AmStar for systematic reviews or CAST for randomized control trials. Once all the review studies were inputted into a spreadsheet, I used a tool that was developed by PHSA to grade this or to assess the strength of evidence linking the research variables. So the tool used criteria to rate the strength of evidence as either being strong, moderate, inconclusive for future evidence review or a new area of study. And this is just the strong criteria of the tool. So the draft planning principles were created after the scoping review, but they were modified as more evidence was gathered from the literature review process. So some of the research that informed the creation of the planning principles, for planning principle 1, the research looked at affordable housing through interventions such as dense housing developments, subsidized housing programs, and private market rental supplements. For the second planning principle, research looked at good housing quality through interventions such as building upgrades, ensuring that housing is free of asbestos, lead, paint, pests, and ensuring that there's adequate ventilation. For the third planning principle, research looked at housing for high-risk groups. This was generally for homeless people, providing shelter for homeless people, as well as providing accessible housing for elderly people so that they can remain in their houses in the community for longer. And the fourth one we've already reviewed in the previous slide as an example, which was looked at environmental hazard exposures related to siting and zoning of housing. So the results of the literature review and strength of evidence assessment was used to create 3 graphics for the healthy housing component of the Linkages toolkit. The first being the healthy housing fact sheet, which provides a descriptive summary of the research evidence from the literature review structured according to the 4 healthy housing planning principles, which we just reviewed in the last slide. The fact sheet organized pertinent findings from the literature review and provide a written summary of the research findings. The second graphic is called the Healthy Housing Linkages Summary, which serves as a quick visual summary of the research links between the 3 research variables, with the focus being to highlight the directionality of the research links. In the graphic, there's a legend provided just to provide clear communication of the symbols that are used in the graphic. And the third one is called the Healthy Housing Evidence Diagram, which is similar to the Linkages Summary, but it provides a more in-depth visual representation of the research linking the 3 research variables. The focus of this diagram is to visually depict the strength of the evidence linking the research variables through the use of various lines. And again, there's a legend included to clearly communicate the meanings of the lines and the symbols used in the diagram. All right, so implications for public health. This is, for my project, as part of the larger Healthy Built Environment Linkages Toolkit. It links health evidence to planning principles with an indicated strength of evidence, supporting the research link, which helps communities to prioritize possible healthy built environment community interventions. It promotes intersectoral collaboration between public health professionals, planners, and members of local government in order to promote the creation of healthier built environments, which, as we know, is related to improved health outcomes. And the information in the graphics and in the toolkit, it doesn't tell you what to do, is not prescriptive. Rather, it provides clear evidence and encourages communities to make evidence-informed decisions about whether or not certain interventions will work. So final thoughts, healthy built environments, including healthy housing, influence health behavior, which impact short and long-term health outcomes. This is important. This is why it's important to promote the intersectoral collaboration in order to achieve healthier built environments. Just because an intervention is successful in one community does not mean it's going to be successful in all communities. That's why the toolkit encourages communities to engage in evidence-informed decision-making in order to ensure that the intervention will be a good fit for the unique needs of individual communities. And lastly, research is still emerging on some key issues, for example, homelessness. But the toolkit is a version 1, and it's a dynamic resource that will continue to be updated as new research emerges. So thank you to everyone who supported me through my practicum experience and my practicum project. I really appreciate it. Bonus information, the Healthy Built Environment Linkages Toolkit was launched on April 8th, so if you're interested, maybe not in housing, maybe in some of the other physical features, it's available on the PHSA website. Thanks.
Okay, Vicki powered through that, so we have time for a couple of questions.
Thank you, Vicki. That was awesome. First of all, that was a lot of information, and your project was very ambitious, as I said to you early on in your practicum. So it's awesome that it worked out so well. I'm so glad you had such a great experience. I wanted to ask you, though, you didn't actually mention very much aspects of equity in terms of what you're talking about, because one of the biggest issues, especially in some parts of BC, is the lack of affordable housing, the lack of quality housing, the lack of accessibility to those things, especially in certain parts of the province. So, and that's a huge issue. But you didn't really cover that. Can you just comment about that a little bit?
Sure. Actually, I didn't include it in the slide, but as part of the model, I can't remember the exact words, but equity is one of the lenses that is applied in order to, when we were kind of looking at the literature. But what I found was in a lot of studies in the research, they've already applied an equity lens, and housing, as you mentioned, is definitely an important social determinant of health, and many of the interventions kind of already apply that sort of lens, so, yeah. Okay.
Other questions? Michael
Just
has
a comment,
one.
really.
Okay, go.
It is incredible to see. I actually was at a meeting on April the 9th in which Tanis presented this, having just gone live with it all. Mm-hmm. And, the history of this is such an interesting story in terms of trying to take. So I was invited to the first meetings on trying to create this template and understand it. And those meetings were crazy because everybody had different ideas about what the built environment was and what should be in and what should be out, mm-hmm. and so forth. And it seemed like it wouldn't have a hope in hell of actually going anyplace. And so it really speaks to the persistence of the people involved and the incredible thoughtfulness in which trying to take this range of information from lots of different sources and synthesize it and put it into a document that is user-friendly and is really meant to kind of just provide direction or give some ideas to people to really start a conversation. It was quite an achievement, and people were very laudable about the whole thing, and people did make specific reference, you need to know this, to the housing module, which they thought was very well done.
Oh, thank you.